Hi, my name's Lily Holland. I'll be doing my central line dressing change video today. Before I get started, be sure to follow my GPSPs, do my two patient identifiers, and assess for allergies. So I'm going to go in my patient's room. Hi, my name's Lily. I'll be your nurse. I'll be changing your dressing today on your central line. Can you tell me your name and date of birth? Okay, and that checks out. And do you have any allergies? And they said no. So the first thing I'm going to do is I'm going to ensure I put a mask on and make sure that my patient also has a mask. And I'm going to perform hand hygiene and set up my supplies. So I'm going to open my sterile kit and get my end cap. Okay. And so I'm going to perform hand hygiene and put on a clean pair of gloves. Okay, and so I'm going to go ahead and assess the site. I'm going to look for any redness, tenderness, or pain, and there's no abnormalities on the site, so I'm going to go ahead and remove the old dressing. I'm going to stabilize the site, and working from the outside to the inside, remove the old dressing. Okay, once I've done that, I'm going to take my gloves off and perform hand hygiene and put on my sterile gloves.
Yeah, that's good. That's good because it's right in the middle. And that's what you get out of it.
And once I've done that, I will come over here and get my cleaning solution, and I will cleanse the site starting up at the top at the insertion site using a back and forth method and cleansing for at least 30 seconds, making sure not to go over the same spot I've already cleaned. And then I will allow that to dry naturally, make sure I don't fan it, blow it, or touch it. So once I've done that, I'm going to get my dressing and apply my Tegaderm. So once I have my Tegaderm on, I will come back over to my kit and prime my end cap. And I'm going to scrub the hub of my end cap before connecting it to my normal saline. And I'm going to prime, and it's primed. I'm going to go ahead and take this cap off. I'm going to make sure my clamp is closed, and it is. I'm going to take off the old end cap. And put the new one on. I'm going to open my clamp. I'm going to flush and then aspirate for blood return, and there's positive blood return. And then I'm going to use the push-pulse method and finish flushing my saline. And once I've done that, I will detach the saline. I will close the clamp, get an alcohol pad and scrub the hub, and apply a disinfectant cap. And my clamp is closed, and so I will do the same exact process for the other two, and I'd make sure I'd label my dressing per facility policy and assess my patient. And then I would clean up my supplies, perform hand hygiene, and then document immediately.